Good afternoon, everyone. My name is Sean McIntosh, Director of Public Affairs at the U.S. Embassy. I would like to welcome you all to this press conference announcing the U.S. President's Emergency Plan for AIDS Relief 2021 Country Operational Plan. I would like to recognize Mr. David Young, U.S. Embassy Chargé d'Affaires, Dr. Kennedy Malama, Permanent Secretary of Technical Services of the Ministry of Health, and Mamadi Yila, U.S. Deputy Global AIDS Coordinator. I would also like to recognize members of the press, fellow colleagues from the U.S. government and from the Zambian government, as well as everyone else joining us today. Now, after I get through much of these housekeeping and admin items, I just want to let everyone know the run of the show. First, the Chargé d'Affaires will speak, followed by the Permanent Secretary. Then we will allow some time for questions and answers from the media, and we will conclude our program. As a reminder, if you are not speaking, please mute your camera. We will make this press conference available as a recording afterwards, as well as prepared versions of remarks of the Chargé d'Affaires. With that, at this time, I would like to ask that Mr. David Young, U.S. Embassy Chargé d'Affaires, lead off with his remarks. Thank you.
Great. Thank you very much, Sean. Dr. Kennedy Malama, Permanent Secretary for Technical Services at the Ministry of Health. Mamadi Yila, the Coordinator for Zambia, the PEPFAR program of the Office of the Global AIDS Coordinator in Washington. U.S. and Zambian government colleagues, members of the press, welcome. Ladies and gentlemen, all protocols observed. It's a pleasure to chat with you. It's a pleasure to chat with you today and appreciate our good friends from the media to join us for a day of a very important announcement. Today, we're gathered to highlight the accomplishments of the U.S.-Zambia Health Partnership as we build even greater momentum to achieve HIV epidemic control in Zambia. Since 2004, the U.S. government, through the President's Emergency Plan for AIDS Relief, or PEPFAR, has enjoyed a robust partnership with the Ministry of Health in responding to HIV across Zambia. With long-standing support, the United States government has invested more than $4.5 billion. That's 90 billion kwacha. 90 billion kwacha in Zambia in response, thanks to PEPFAR. The impacts of this assistance have been extraordinary. Think for a moment of what it means. The lifespan of Zambians since 2004 have gone from an average of 44 years of life to 64 years of life, 15, 17 years later. That is an extraordinary testimony to our partnership together. And it's the result of our work together through PEPFAR and the fight against HIV and AIDS. Let me highlight some of the accomplishments of the U.S.-Zambia partnership. Today, more than 1.1 million Zambians are receiving life-saving antiretroviral treatment. Of those on treatment, more than 90% are virally suppressed, meaning they can live healthy lives and cannot spread the disease of HIV to others. Over 680,000 adolescent girls and young women have received evidence-based HIV prevention services and interventions to ensure they remain HIV-free through the DREAMS program. In addition, 2.1 million voluntary medical male circumcisions have been completed in an effort to prevent the spread of HIV. And more than 80,000 Zambians are receiving HIV pre-exposure prophylaxis, PrEP, to prevent them from becoming HIV infected. Now, I'm pleased to make our important announcement. After the conclusion of the 2021 PEPFAR Country Operational Plan, my government will provide Zambia with more than $400 million this year, 8 billion kwacha, in additional funds to expand life-saving HIV programs that will continue to strengthen the health of Zambians. 8 billion kwacha is a lot of kwacha, and it shows that our friendship and partnership is deep. And when Zambia thinks of its friends, think of 8 billion kwacha to save more than 1 million lives. When that is the sign of our partnership that Dr. Kennedy Malama and I and our team shake hands on today, that's a sign of a partnership that saves lives. While all of these numbers might quantify the magnitude of our support, I believe that the personal impact of PEPFAR in many ways better illustrates our commitment. So therefore, let me tell you a story about a young woman from the Copper Belt named Hope. You might have heard me tell this story before, but it is such a shining example of PEPFAR's extraordinary results that I love saying it again. When Hope was 14 years old, her father died, and her family became a victim of poverty. She and her younger sister had to drop out of school. Her mother and the family were forlorn. What would their future hold? Hope enrolled in the DREAMS program funded by PEPFAR. DREAMS is a program that mentors vulnerable adolescent girls and young women. It means determined, resilient, empowered, AIDS-free, mentored, and safe. DREAMS. A year after joining the program, Hope's life changed dramatically, and she found new hope to open a better future for her life. She earned a scholarship and enrolled in a heavy machinery repair course. And in a short time, she was outperforming many of her male classmates and excited to take charge as a trailblazing young woman in a new field of opportunity. She began to earn a good salary and provide for a successful future. Today, the DREAMS program is transforming the lives of more than 650,000 girls and young women. And across Zambia, there are many other stories like Hope's. She gives us optimism about the good work we do together, the United States and Zambia, each and every day. Think for a moment. Girls and young women like Hope can be the entrepreneurs, the leaders, the scholars, the professors, the ministers, the vice presidents, the presidents of Zambia of tomorrow. That's what DREAMS does. While we celebrate PEPFAR's success, we must also recognize the challenges we faced this past year due to the COVID-19 pandemic and the intense demand for better COVID-19 testing capacity, more training for healthcare workers to provide critical care, infection prevention control, and many other areas. Towards this effort, I'm pleased to announce as well that the United States government through PEPFAR will contribute an additional $20 million or 500 million kwacha to mitigate the impact of COVID-19 on people and resources. So in addition to the prior $24 million dollars of support, more than $500 million to PEPFAR's COVID-19 response in Zambia, this funding will help the national HIV response remain resilient and responsive in the midst of COVID-19. If you're like me, sometimes these figures can get confusing and you forget which one is which. The long and short of it is, it's a lot of money, it's a lot of cooperation, and it's a lot of lives saved. I remain confident in our strong cooperation between the United States and Zambia. With 17 years behind us, we will continue to leverage resources to bolster the resilience of the health system and respond effectively to both HIV and COVID-19. The United States government remains committed to improving Zambia's health security through PEPFAR, the President's Malaria Program, and other health investments. Our partnership is long, deep, and broad. It builds on the past, it's strong in the present, and it's going forward powerfully into the future. Finally, I'd like to emphasize that achieving success in our HIV response would not be possible without the leadership, commitment, and progressive policies of the Zambian government, and particularly the leaders in the health ministry, like the Permanent Secretary, Dr. Kennedy Malama. As a result of our successful partnership, Zambia is closer than ever to reaching and maintaining HIV epidemic control and having an AIDS-free generation. And one last note, as Zambia prepares for the August general elections, I encourage everyone to exercise your civic duties peacefully while staying healthy and safe. We look forward to a peaceful election in Zambia, and we look forward to fair treatment for all parties, all candidates on an equal playing field in the democracy of Zambia. Thank you for joining us today to help amplify the importance of building a strong and sustainable health system in Zambia that both improves and saves Zambian lives. And now let me turn it over to my good friend and our wonderful partner from the Ministry of Health, Dr. Kennedy Malama, the Permanent Secretary for Technical Services. Over to you, PS.
Your Excellency, let me start my remarks by recognizing you, the United States of America Chargé Affairs, Mr. David Young. I also recognize the presence of Mama Diira from the Office of the Global AIDS Coordinator in Washington, colleagues, representatives from the Embassy of the United States of America. I recognize the members of the press. May I simply say, distinguished ladies and gentlemen. 18th May 2021 is a remarkable day that reaffirms the partnership between the United States government and the government of the Republic of Zambia. The US government, through the President's Emergency Plan for AIDS Relief, PEPFAR, held a virtual meeting from the 28th to 29th April 2021 to jointly review the key policies, strategies, and activities to be undertaken under the Country Operation Plan, or COP 2021, which aims at moving Zambia to achieving the HIV and AIDS epidemic control. This important meeting marked yet another milestone in the Zambian government's strengthened strategic partnership with the US government through PEPFAR in improving the health and well-being of our people. The United States government through PEPFAR is our biggest partner in the health sector in accelerating Zambia's progress to achieving epidemic control of HIV and AIDS. PEPFAR support in Zambia has been critical to fast-tracking Zambia's HIV and AIDS response since 2003, when there were only 3,500 people living with HIV who were on the life-saving antiretroviral therapy, to the current number of 1,100,000 people on treatment. We remain indebted to the people of the United States and its people. This investment has significantly contributed to averting so many deaths which would have occurred in our country without this support. We've seen further progress in HIV and AIDS prevention, care and support, and as it was alluded to, malaria, and also programs related to reproductive, maternal, newborn, child health, and nutrition in our country. The one-year bilateral grant agreement with PEPFAR to be signed after the United States congressional approval of the Country Operation Plan for 2021 will provide the framework for PEPFAR's financial support to the HIV and AIDS response in Zambia. The next annual funding cycle, which starts in October 2021, PEPFAR, as it has been alluded to, will provide Zambia with over 8 billion kwacha as part of the HIV and AIDS response. This is unprecedented. Further, the United States government, through PEPFAR, will provide an additional $20 million as part of the COVID-19 response in Zambia. This will enable us to strengthen systems and ensure that Zambia is resilient enough to be able to respond effectively and efficiently to the COVID-19 threat and enhance health systems strengthening. The Zambian government has made great strides in the fight against HIV and AIDS and continues to explore various ways of tackling the HIV and AIDS epidemic. This funding, therefore, will offer the financial thrust for us as a country in a collective manner to achieve our goals in 3 strategic areas. Number 1, prevention of HIV transmission, focusing on adolescent girls and young women and their male partners, comprehensive condom programming, priority populations, pre-exposure prophylaxis, and voluntary medical male circumcision, among other high-impact HIV prevention programs. Number 2, care and treatment of people living with HIV. And number 3, strengthening the public health systems to effectively and sustainably respond to the epidemic and other public health threats. The government of the Republic of Zambia, under the leadership of His Excellency, the President, Dr. Edgar Chagwa Lungu, remains resolved to achieving and sustaining the apt UNAIDS targets of 95, 95, 95, calling for ensuring that 95% of our people living with HIV know their HIV status. 95% of our people diagnosed with HIV are on ART, and further, 95% of those on treatment attain a suppressed viral load. This is achievable with the kind of collective investment we continue receiving from PEPFAR, and we give you assurance that government will continue building on its domestic investment for us to attain epidemic control of HIV. It's clear that the last 95 is critical in maintaining the health and well-being of infected individuals and stopping further HIV transmission. We are delighted as a country that as at 31st March 2021, we collectively achieved 93, 96, 92 overall in line to attaining the 95, 95, and we shall continue building on this. Again, it's important to note that Zambia is among the top tier countries in achieving the UNAIDS targets. Nevertheless, finding people who do not yet know their HIV status, especially young men and women, and men above 50 years old, remains our priority focus, and initiating them on treatment and ensuring that they remain on treatment, and we'll continue building on this. Given Zambia's youth bulge, adolescents and the youth remain a priority population for us in terms of HIV service provision, considering the demographic dividend this cohort presents to our country. Globally, PEPFAR is on a path towards transitioning more with support to government, parastatals, local institutions, civil society organizations, and the private sector. Expanding this partner base in Zambia will ensure that achievement and gains made in HIV services are sustained. It will further facilitate reaching the marginalized and rural and remote populations in our country. To do this, it's imperative that community services are expanded and enhanced, anchored by respective community-based organizations. And as a ministry, we fully support this paradigm shift, and we commend you, Chargé Affairs, and the Global AIDS Coordinating Office in Washington. Therefore, with the approval of COP 2021 comes an opportunity and a platform for us as Zambia and also the US government to engage at policy and strategic levels with the goal of jointly defining the journey to self-reliance and sustenance. This partnership further gives us an opportunity for PEPFAR to support Zambia's socio-economic developmental agenda. Let me take this opportunity once again on behalf of the Zambian government to sincerely appreciate the government and the people of the United States for this funding and the continued support to the fight against HIV and AIDS, and indeed support in other program areas. Achieving these results has not been easy, but we are convinced that together we can do it. I would like to applaud the the US Embassy in Zambia, PEPFAR, USAID, CDC for the collective engagement, cordial working relationship, and the partnership we continue to enjoy. This support has indeed been catalytic on which other partnerships in the health sector have continued learning from and also leveraging on. Working together, we've gotten to the last mile in attaining HIV epidemic control, and the remaining steps to victory will even be harder. Let me once again thank all of you for the support and for being part of this press brief. Thank you very much, and may good Lord bless all of you.
Thank you very much, Chargé Young and Permanent Secretary Malama, for your remarks. We are indeed celebrating a great moment in our relationship and our journey to fight HIV and to end AIDS once and for all. We look forward to combating the challenges ahead. At this time, I would like to open the floor for any members of the media to ask some questions. We have a little bit of time left. I don't think we have much members of the press in here, so I won't necessarily ask people to raise their hand in the chat, but I would like to try to see if you all can intervene one at a time in raising your questions. And when you do ask your question, please first state your name, followed by your media organization, followed by your question. Thank you. Any questions? There's no time to be shy. Okay, that's fine. If there are no questions, then I think we can go to the conclusion of the press conference. In the chat, I just put a link to Chargé d'Affaires David Young's remarks on the U.S. Embassy's website. So if media want some text, you can go there and momentarily you will see our press release. We'd like to thank everyone for joining us today, and let us look forward to dealing with HIV and AIDS. And then one other thing I want to say to everyone is to get vaccinated if you haven't done so already.